All right, Jim, thank you so much. Well, in your health news today, most moms-to-be may not be thinking about past partners and the possibility of contracting a sexually transmitted disease. However, the CDC says STD rates are on the rise in South Carolina, and pregnant women are no exception.
That's a scary thought. Medical reporter Rosemarie Beltz is in studio now with a local specialist to talk about how an STD can affect your baby's health. Rosemarie.
The most recent CDC STD report shows that rates nationally, are on the rise. I'm here with infectious disease specialist from Prisma Health Children's Hospital, Dr. Kathryn Burch, to talk about, what we're actually seeing here locally in South Carolina. What in your practice are you seeing affecting women?
Oh, I definitely am seeing the rise of syphilis, but other STDs too, like chlamydia and gonorrhea as well. And unfortunately, all three of those infections can be passed along to the infant when they're born.
So, I read that pregnant women could be missing, in their STD testing early in their pregnancy. They could be contracting an STD after, they're tested. So,
sure.
So what do you think? Do you think that's accurate, or why do you think we're seeing such high numbers?
Well, I think that we do a good job at screening moms during the beginning of their pregnancy.
Right.
So every mom gets screened automatically for certain STDs. Gonorrhea, chlamydia, syphilis, even HIV is in there as well, okay? But sometimes I think we forget pregnant women have sex.
Right.
And they can have unprotected sex during their pregnancy. So if you are at risk for those behaviors, or you're in an area where the rate is increased, like South Carolina, technically we should be monitoring at least for syphilis again prior to delivery.
So with that, and correct me if I'm wrong, but a lot of these STDs have no side effects or no symptoms, and can present really non-specific. Is there a time in their pregnancy that you suggest that maybe they get tested where it's safe and then treatment is safe?
So the guidelines recommend that every woman get tested at the beginning of pregnancy, and that is the safe time that you do that. Still definitely get treated for these diseases right before delivery, but it helps us to know what we need to do with the infant when they're born.
I think that's really helpful in case women are watching and thinking that they could be at risk. So thank you for clearing that up. And talking about risk, these STDs during pregnancy and for the infant after have some pretty serious consequences, if you can talk about that.
Yeah, so congenital syphilis is one of those things that if you don't catch it early can have big consequences for a child as they grow up. It can cause hearing loss, it can have problems with vision, it can cause developmental delays, all those kind of things. So pretty significant complications if you don't catch it.
Right, and when the infant's first born, we might not even catch,
Absolutely.
catch it right away.
A lot of times they are completely asymptomatic. So we might not even know for the first couple of months of life that they have contracted syphilis or other STDs from their mom.
And before we wrap, if somebody has to get tested or feels like they should get tested, where can they go for this sort of testing?
So they can either go to their primary care physician, their OBGYN, or they can always go to the health department.
Thank you, Dr. Burch, and we will be back right after this.